Hello, and thank you for joining us for this special Facebook Live event on teens and mental health. The teenage years can be emotionally challenging and overwhelming, and teens struggle with mental health issues in silence. We're here tonight to talk about a very important topic, building self-confidence and connectedness in our teens, as well as identifying warning signs and taking appropriate steps for better mental health. Having raised two daughters myself, I know the struggles parents and adolescents face daily. I'm Dr. Dave Miers. I'm the Senior Director of Behavioral Health Services here at Bryan Medical Center. I've been with the medical center for about 26 years, and during this time, I've seen the pressures on our youth continue to build year by year. The Center for Disease Control now reports that about 1 in 4 high school students are feeling persistently sad and hopeless, and nearly 1/3 are struggling with poor mental health. We're here tonight to share important information and resources with you and to answer your questions. You can go online and submit these questions through the comments section for this event on our Facebook page, or link out to a page where you can submit your questions anonymously. We will also have a link at the end for all the references that we're going to reference throughout tonight's presentation. Tonight's guest is Andrea Ruiz. Andrea received her master's degree in counseling from Doane College and is a therapist at the Bryan Counseling Center. Hello, Andrea, and welcome, and thanks for being here tonight. I want to thank you for being a member of the Bryan Counseling Center, and we were very excited that you joined our team. And I want to thank you. I know you have a very busy schedule, and taking the time out to share some very important information with Facebook Live viewers tonight. But before we get going, why don't you tell us a little bit about yourself?
Thank you, Dave. I'm happy to be here tonight. This is such an important topic, and I'm thrilled to be part of this conversation that we absolutely have to have about this emergent crisis that's coming in. As you mentioned, I received my master's in counseling from Doane University now in 2008. I've been doing outpatient therapy for about 15 years, and I joined the counseling center about a year ago. I enjoy working with adolescents and young adults, really because that stage of life is such a developmentally transitional time that can really be confusing and just difficult to navigate at times. So I really like working with that population of all the ones that I have worked with. I know growing up 25, 30 years ago was difficult, but it's definitely compounded over the last several years. And I think that this data that you mentioned is really pointing to that emerging crisis, as I said. So I'm hopeful to be able to answer some questions, provide some good information and some quality resources here for families.
Great. Thank you. So to start out with tonight, we have some kind of set questions that we've put together that I want to ask you, and then when we get through those, then we'll open it up to the Facebook Live audience and have them submit some questions. But the first question that I would like to start out with is a question that I receive a lot, and I've received a lot throughout my career, and I'm sure you get this question a lot as well, is when should I be concerned as a parent? What are the warning signs, the triggers that a teen is struggling, and then when should I take action? What is the first call to action that I should make?
Yeah, that's absolutely a great question. I do get that a lot. We've put together some slides to share with people, and this first one is all the warning signs that I would say are big red flags that parents should just not ignore at all. And I will first of all say, if you have an immediate concern for your child's safety, do not leave them alone. And these signs would indicate an immediate concern to be paying attention to. And those would include talking or writing about death, dying, or suicide, thinking about or threatening self-harm or suicide, seeking access to means of suicide, such as gathering pills or weapons, giving away prized possessions, and then that feeling hopeless, helpless, worthless, or trapped. In any of these situations, you can call a suicide prevention lifeline, which will have some of those resources listed here, but 988 is a good one to remember. Lock up any potentially lethal objects, And any child who's or person who's actively trying to harm themselves or another person should really be taken to the closest emergency room. And police, rescue personnel can assist with that if they're not willing to go. I would also, outside of warning signs, I would also just recommend you look for changes, shifts in sleeping, eating habits, not taking care of themselves, ignoring hygiene, different things like that. Issues at school, such as slipping grades, conflict or isolation from friends, spending more time alone, anger outbursts or mood swings, losing interest in activities they used to love to do or avoiding certain situations. But staying in tune with their social media posts, any sign of bullying, either direction, whether they're being bullied or they're bullying would be a big red flag. And then any beginning or increasing use of drugs or alcohol would be another significant change to pay attention to. Always keep the lines of communication open or work to open them if they're not open. Be direct and compassionate. To be honest, lots of kids tell me they don't even know how to bring this up with an adult or someone. Prompt them, ask them if you feel like you're noticing any of these changes. And then seeking out professional support if you need to. You can start with your pediatrician or a mental health professional, but any indication of suicidal thoughts may benefit from an evaluation and treatment through a mental health provider. We also have some crisis resources I'd like to share here. As I said, the 988 National Suicide Prevention Lifeline. It was rolled out about a year ago under the 988 number. The crisis text line, where you would text TALK to 741741. Those are really great go-to resources for crisis. Bryan Health also has a mental health screening resource on our counseling center website, and if you go to that page, you can take an online mental health screening, and then that will help identify some resources to help match those needs.
Yeah. So the parent, caregiver looks for these warning signs, but also they should be listening to their friends and teachers and others as well, correct?
Yes. Yeah.
Yeah.
Mm-hmm.
Okay.
Yes.
Yeah. How do we build self-confidence in our youth?
That's a good question. Yeah. Because that's huge. An important piece of building self-confidence is going to be identifying and clarifying some of their interests and values. Sometimes these are really obscure to people, and I'll spend a session or two really working with clients on these. Some online resources for this for you. One that's good for identifying values is called Think to Perform. On this, you sort values and try and get down to, I think, about 5 out of 100 that you start with. And then another resource for interest identification is called U for Youth. And it's a government-based, it's a .gov, so that would be a good quality resource to help identify interests. The goal is to really help identify activities and groups that maybe match what kids are interested in liking and valuing, because that can help build passions for these things, which can lead to building confidence. Another area that I work with people on, when I'm working with them, is building affirmational statements. So these are statements that we say to ourselves that are positive and hopeful, often intended to challenge negative self-statements that are hallmarks of low self-esteem and depression. So affirmations need to be intentional and meaningful. They're often very difficult to accept and believe, so it's important to rehearse them, is what I call it, rehearsing, or repeat them over and over. If it's hard to believe, sometimes it doesn't feel like you're doing anything with that, but honestly, research shows that the more exposure to positivity people have, the more hope we can build within ourselves. So, and actually with that rehearsal, we can actually start believing these positive things over the negative self-statements. So how to come up with affirmations, though? Google's our friend, but there's lots of them out there, and you can really look for specific topics like maybe test taking or social anxiety or maybe body image problems that kids have. And there's a lot of affirmations specialized to that. but it can also be very overwhelming. So a really good resource for that would be an app that's called I Am. It just gives you one affirmation a day, and you focus on that one for that day. So.
Wow. Well, what I'm hearing you say, and you've said it a couple of times, is hope. And I think that's a key thing that we want folks to take out of tonight, is that, there's hope, there's help, and there's healing. And so again, at the end of tonight's program, you'll see a link to all the resources that Andrea is referencing, and it'd be important to visit that link, because you're given a lot of great resources, and that's some great ideas to help build self-confidence in our youth. The next question deals with mental illness, and not all symptoms lead to mental illness. All of us, all adults, but all youth, we all have bad days, and we all have days where we're feeling down. But sometimes, anxiety and depression does come about in youth. And anxiety and depression are two of the most common mental health concerns. So what should parents know about anxiety and depression, and about the treatment and what to expect in that process?
Sure, yeah. Well, there's a lot to talk about here, but I'll try to condense it. I could speak for an hour on this. Because it's what I do. But treatment really, it can range from, if you're in crisis, going to the mental health emergency department, or stabilizing in an inpatient setting until you're safe to be not having to have 24-hour monitoring. There's more intensive resources like partial hospitalization or intensive outpatient. But probably the most common treatment that people are most familiar with is outpatient weekly sessions with a licensed mental health provider. That's what I do, so I can speak to that the best, but that is actually probably the most common treatment. You can also find some treatment options or resources through your pediatrician or your primary care provider. So those are just some options of different levels and types of care. As far as the primary care physicians, I am actually seeing a positive uptick in the fact that more of them are doing these screens for anxiety and depression with their patients when they're in their offices. And that is so encouraging, because we can catch it ahead of time. We can be more proactive in helping get those higher risk youth the help that they need. And often a lot of my referrals come directly from their primary care physicians. So that's a really good thing. And also pediatricians, primary care physicians can help with medication needs. Sometimes they're limited in what they can do, and they'll need to refer you to a psychiatric provider, but you can start there for those needs as well. At Bryan Health, we have a broad spectrum of all of these options, so our website can outline those for you as well. I did want to, though, talk about some of the different therapeutic techniques that are common when you are in, say, outpatient therapy. Cognitive behavioral therapy is effective. Is a very effective method. It's helpful in becoming aware and learning how to influence your thoughts, feelings, and behaviors, and then also knowing how they influence each other. I often help clients learn how to challenge their negative beliefs and choose more healthy and positive behaviors. Grounding exercises, for example, the 5-4-3-2-1 method is a common technique or group of techniques that we teach. The 5-4-3-2-1 method is a sensory-focused method, and it's going to be where you look around for 5 things you can see, 4 things you can hear, 3 things you can smell, 2 things you can touch, and 1 thing you can taste. I usually leave that to the end so people aren't going around licking things. But no, the idea, though, is really to distract yourself from those intense emotions and feel more in control. So that's what grounding can do. Coping strategies will help focus on choosing healthier behaviors like listening to music, making art, exercising. And this is often the first thing that I give to people. My coping strategies sheet has 50 examples. I've seen them with more. But again, it's looking outside the box, finding activities that can help you find peace and stability so you can be more in control. And then lastly, relaxation techniques like breathing or meditation. The 4-7-8 breathing technique is my favorite technique that I use personally. In that one, you breathe into the count of 4, you hold to the count of 7, and you breathe out to the count of 8. And there are physiological evidences that can show that that will effectively reduce your heart rate, reduce your breathing, and help calm. And then meditation, that's, some people have a different conceptions of that. I always advocate for that to be, implemented into self-care routines, whether that's, anywhere from the traditional meditation, where you say Om, that's what I always get from the kids. What's meditation? I sit on the floor and cross-legged. But, or guided meditation, or even prayer sometimes can be considered a meditation. So a lot of people say, I can't shut my brain off, I can't meditate, and I always say, well, it's a skill, and you have to practice to get it.
Yeah.
So
a lot of techniques, there's a lot of tools out there for folks to try, and getting into therapy and working with a therapist such as yourself and trying some of those things. Just a lot of great ideas. Thank you. One of the things that when we talk about depression, and I just want to make folks aware, is that not everybody who's depressed is suicidal, but we do know that those who are suicidal and those who have died by suicide, research shows that 90% of them would have been diagnosed with depression, or they were diagnosed with depression or would have been diagnosed with depression. Mm-hmm. And so it's important that we do talk about suicide. And suicide is a growing concern amongst our teens. It's the second leading cause of death for youth ages 15 to 24. So what are the warning signs that we should be aware of regarding suicide, and how can we approach our teens if we're concerned about suicide?
Sure, yeah. And this will kind of be a repeat of what we said, but it's definitely important information to be repeating. If you have an immediate concern, take them to the emergency room or call one of those crisis lines. Definitely do not leave them alone. As we talked about before, warning signs that would indicate an immediate concern are talking or writing about death, dying or suicide, thinking about or threatening self-harm or suicide, seeking access to means of suicide, giving away prized possessions, and then the feelings of hopelessness, helplessness, worthlessness, and feeling trapped. To approach your teen, honestly, direct and non-judgmental is the best approach. And again, if they're having difficulty connecting with you, try to find someone that they can trust and connect with. Maybe that's a trusted extended family member, a school counselor, teacher, coach, mentor, a pastor, youth pastor, extracurricular group leader like a music teacher, scouts leader. And again, I'll reiterate that approaching the subject, many youth don't feel comfortable or don't know how to bring this up, or they feel like they don't want to burden or scare their loved ones by talking about it. We can't help them if we don't know. So, bringing it up if you see any of those changes or warning signs. There are some great resources. SAMHSA, which is the Substance Abuse and Mental Health Services Administration. I always forget. But they have great resources on their website, which is on the reference page. They have a family support guide, which is just a brief overview, but then they have an even more in-depth one that's several pages long. I have actually pulled some examples of conversation tips from their conversation guide that's on the website, and I think we're going to show those on a slide. And so I'll just kind of go over those. Some statements maybe, I've been worried about you. Can we talk? If not, who are you comfortable talking to? Or, I see you're going through something. How can I best support you? Or, I've noticed you haven't seemed like yourself lately. How can I help? These are all great, like I said, direct but non-judgmental approaches to bring up. Another good resource is the American Foundation for Suicide Prevention. There you'll find stories of suicide survivors and their supporters, up-to-date statistics, ways to get involved, and this all kind of leads to hopefulness. Again, if you're in an emergency situation and your adolescent is exhibiting the warning signs we've mentioned, any of the crisis lines are excellent resources. And as I've said, the 988 the helpline from 988 and the crisis text line were both mentioned earlier. I also noted that the Trevor Project has a crisis line geared and focused on the LGBTQ plus community, and the Trans Lifeline is focused toward specifically transsexual individuals. So those are great resources for crises as well. And the only other thing I would also note with these helplines is that they often have an automated menu when you first call. And I think that that's important to note because it can be an off-putting thing if you're in crisis. However, the goal of these are always to reduce suicidal intensity and make a plan to stay safe. So to do that, they want to be as individualized as they possibly can. They route you to the correct resource by noting your area code that you're calling from so they can kind of pinpoint what's closest to you. They'll identify individual needs so they can actually route you to the Trevor Project or Trans Lifeline. There are options for veterans, Spanish-speaking options, just a lot of ways to get what you need specific to your individual needs. Yeah.
So there's hope, there's help, and there's resources. There's just a lot of resources there to help somebody, and ask the question. If you're concerned about your youth, don't be afraid to bring it up. Ask the question. You know, the examples that were given on the screen, those are great examples. One of the myths that's out there is if I bring it up to them, it's going to make it worse. That's absolutely a myth. The best thing that you can do is to ask the question, because as you said, the youth is generally doesn't know how to express their feeling, and that's true for adults too. Adults want to talk about it, and they want somebody to ask them about it. So, absolutely. Great information. Community and connectedness. Research shows that the more someone is connected to their friends, family, community, school, church, the less likely it is that they're going to act out towards themselves. Use drugs, alcohol. How can parents help build that connectedness in their youth, and why is it that it's so important for their mental health and overall well-being?
Well, and I look at this as maybe look at it two parts, right? First, there's the good connectivity between parents and children. And secondly, helping them connect to the community. So starting with the parent-child connection, you know, connecting to adolescent children is difficult all the way around. So I like braverytips.org. It's a good resource for some of these things, many of these things actually. There's depression and suicidal tips. There are tips about bullying, but there's also tips about building healthy relationships. And I actually pulled some of my information from their Building Healthy Relationships tip sheets. So some connection tips, and these are less when we are in a crisis and more just kind of generalized. Yeah. So, you know, talking with your kids about boundaries, you know, more discussion of why and how to set good boundaries while also role modeling having good boundaries as parents. This can help create an improved understanding, which can lead to improved connection about, you know, why are you setting these boundaries with me? Additionally, this helps the youth learn how to build their own boundary skills, and that can help lead to confidence when they're successful in that. Teaching kids it's okay to say no. This is, parents have to say no, and I think that's a big problem when kids aren't ready to accept that. So, you know, starting in the less conflictual times and talking about why is it okay to say no, this goes along with boundaries. And then understanding and discussing how conflict is normal, and it's normal in all relationships, whether it's friends, siblings, parent-child relationships. It can help ease excessive emotion if a child understands conflict is normal and we can resolve this. We can get back to being okay. And then knowing when to apologize is so important. You know, being able to understand and be tolerant of making mistakes is key to being able to repair those relationships when they're ruptured. So another area I would suggest is knowing your kids' friends, taking time to talk to them about their friends, meeting them when you have the opportunity. So those are important things. For connecting in the community, I would again point back to identifying interests and values and then looking at those available resources to match those. Lots of local resources that can help our children and youth build local connectivity. For younger kids, there's a quarterly publication called Lincoln Kids that is a free publication. I've seen it in grocery stores, libraries, pediatrician's office. My church has it laying around. And this provides up to, like I said, quarterly clubs, groups, activities that are coming up. Another online resource that's a little bit more frequently updated is called Macaroni Kid. I'm pretty sure she posts about at least weekly, but they're what's going on in Lincoln area this weekend, or so it can give some really good up-to-date activities for especially the younger kids. For older youth, we have really great resources like the Lighthouse and the Bay, among other resources in the community to help support positive interactions among youth and building supportive relationships. And then again, there's always school resources like clubs, sports, academic teams, and your school counselor would be a great resource for those things.
Okay.
And you were going to talk about my companion. I don't know as much about that because I wasn't involved in developing it, right? So.
Well, there's an app, and I think we have a slide for that. It's called the My Companion app. So it's a phone app that parents can, and teens and youth. So it's geared towards ages 15 to 24. That you can go to the Apple Play Store or the Google Play Store and search My Companion. And it was developed by the Nebraska State Suicide Prevention Coalition. With the Don't Panic Labs here in Lincoln, and really looked at an app that we wanted to develop to look at connecting with kids where kids could journal, and so they could pull out their phone and just write, what was good about today, who did I meet today, and then they could put that person's contact information in there, that they could reach out to them to make that connection. And then if they were having a bad day, they could reach out to one of those connections, but then it has an immediate link to the 988 hotline or the text line, and then if they are suicidal, they have that immediate connection. So it's a great resource.
Yeah.
So our teens do spend a lot of time at school. What is the best way that we can collaborate with the school if there's concerns about our youth?
Yeah. Yes, they spend a lot of time there, probably more, at least half of their time there. Yeah. So that's a great question. I always advocate for good communication with teachers, administrators at the school. I mean, they're the grown-ups there, so having a good relationship with them is great. And then, also IEP, individual education plan, or 504 plan managers if your child has one of those. Coaches, mentors, taking advantage of those online parent portals that many schools use now, where you can identify grades, missing assignments, what curriculum is coming up, or, even truancy type things. Those are great resources that are available to parents. And then, of course, school counselors, school social workers, and school psychologists are resources for the mental health concerns. There are actually some screening tools that I believe some schools are able to utilize. One in particular is the SBQR, which is the Suicide Behaviors Questionnaire revised. And that can be administered at the school level, too. And then we have a slide to kind of point to some mentoring programs that I kind of briefly mentioned, but Teammates and Big Brothers Big Sisters are great resources to connect your child with a mentor to add that extra connectivity. And most schools have the ability to help you connect your youth to a mentor.
Great. Well, one thing it's important for us to touch on is substance use. Substance use is an area of concern in our youth. Where do parents start addressing with substance use? Where do we begin with that?
Well, again, I'm just going to go back to that direct approach, having real talk about it. These are serious topics and we can't skirt around it. So if you have concerns, bring it up. I'm just going to drop some statistics here because they're important to note. In 2021, these statistics indicated that 23% of high school students had reported drinking in the last 30 days, which seems like a lot, and it is. It's actually going in the right direction. 10 years ago in 2011, or 10 years prior, in 2011, those numbers were closer to 38 to 39%, depending on gender. So positively, we're going in the right direction. But we're still looking at almost a quarter of adolescents who are engaging in alcohol use. And then we also want to look at binge drinking because that's a huge concern and has many implications for negative health outcomes and all kinds of things. In 2019, it was reported that 14% of high school students had engaged in binge drinking in the last 30 days. So that's a pretty big percentage, I think. And it's important to note that binge drinking is defined as having 4 or more drinks in 2 hours for females and 5 or more for males. But we're talking about youth, so probably 4 would be. But binge drinking detriments, and many of us already know these things, but it's worth repeating. There's issues with sleep, mood, anxiety, and other physical consequences, long-term effects of cancer, liver disease, cardiovascular issues, and the like. But more acute issues could be alcohol poisoning, accidents, and not just limited to car accidents. Some kids fall, if they've been drinking. Increased violence, respiratory depressions, not being able to breathe well, loss of consciousness, or even death can be, just from drinking. So parents should really address alcohol use, including binge drinking, early and on a regular, ongoing basis. I'm saying like 9 or 10 years old, start talking about it. And they're talking about it in schools. They're talking about what is alcohol, what are these things. So it doesn't hurt to start then. Definitely don't wait until they're in crisis. That could be too late. Keeping a non-judgmental, open stance when you're talking to your youth. Making sure to discuss the parents and any other family risk factors that may be of note. It's proven that youth with family members with substance abuse problems have a higher rate of developing their own addiction issues. So that's good to note as well. Our Bryan Health Independence Center has some really good resources to note. On the homepage, there is a free and confidential online screening, similar to the mental health screening on our counseling page. And then it will help you decide if our services are going to be able to fit your needs. At Independence Center, we have resources like drug and alcohol evaluations, outpatient treatment, youth treatment, other levels of care, not just outpatient, recovery resources, support group resources, many, many things. Lots of other resources in the community as well that have all those same things. Another service that I know the Independence Center provides, probably there are other agencies as well, would be a SCIP evaluation. And SCIP stands for School Community Intervention and Prevention. And this is a statewide Department of Health and Human Services sponsored program that coordinates with schools to help identify and support student mental health, emotional, and behavioral health concerns. So they can help you find resources if you need that as well.
Correct. Yep. SCIP program is a great program. It's where they identify a student that's in maybe in need at the school, and then they talk to the parents and then give them a list of places that offer those SCIP evaluations, and then the parent gets to pick, basically. Yeah.
Okay.
Yep.
Good.
Very good. Well, one of the things that I mentioned earlier was a phone app, and so we're cell phones, and it seems like we're a lot of discussion about apps and phone use. So we do hear quite a bit about cell phone use and social media, and it can be confusing with all that information about teen mental health. So can we discuss a little bit about the impact that cell phones and social media continue to have on youth?
Yes, absolutely. I think about this in comparison to how we prepare our kids to drive. You know, we have so much framework and guidance to put our babies, our little kids, into these big metal contraptions that could hurt them in many ways, right? But we don't have nearly as much as far as resources to help them with the internet. And research is showing a direct link between social media use and depression. So the more you're using social media, the more likelihood there's going to be a depressive issue. So this is especially true in adolescents. So it's really important that as parents we are looking for those resources and trying to find guidelines and help provide some framework for them. One way, and sometimes this is easier said than done, is to advocate waiting for as long as possible to allow social media use. And most experts are going to agree with this. But it's not like when I was a kid and programming your VCR or setting the clock on the VCR is the divide of technology. I mean, keeping up with smartphones and the media is really difficult for parents these days, especially with the ever-changing climate of technology. So so there are resources out there, but honestly, sometimes, and if you can, your kids are the best resource, and they relish at times to be the expert, if you will. So I often will ask some of my adolescent clients, what's the good apps these days, But that's not always available. So there are resources like commonsensemedia.com or commonsensemedia.org or wait until 8th. But I will also just kind of point back to, it's not just our kids. I think we have to start with ourselves and look at our own social media and phone behaviors and habits. There's new research showing that there's dependence on your smartphones that are similar to dependence on drugs, alcohol, gambling, and those other addictive issues. Educating ourselves, being more mindful, these are very important things to be doing, and asking ourselves, am I being a good role model?
Yeah.
So.
Yeah. Great information. Thank you, Andrea. We've covered a lot of topics. You've provided a wealth of information. So we're going now to focus our attention on questions from the viewers. So a reminder, if you have questions, go ahead and please put those into the Facebook Live, or you can use the other link if you want to put those in anonymously. But we're going to go ahead and move into some of those questions that have already been submitted. First question is, how do you distinguish between normal teenage behavior and something that needs more attention due to the mental health concerns?
Yeah. Well, those warning signs that we've put up a couple of different times are definitely not normal behavior. Talking, writing about death, dying, or suicide, threatening suicide, self-harm, access to means of suicide, giving away prized possessions, hopelessness, those aren't normal. Those warrant treatment, warrant attention. Some of the others, though, that I mentioned, like changing habits, moodiness, increased moodiness, conflict and drama in maybe any or all relationships, changing interests, some of that is normal, but how do you differentiate? Well, the key to that is really communicating with your child and discussing your concerns with your child and seeing what they say. And if you're still concerned about these shifts or these behaviors, it definitely doesn't hurt to reach out for professional help. It can be as simple as I've said, as meeting with the pediatrician. They can do those scales, like I said, and help identify resources. And then, brief therapy. I don't think we talk about this enough, but it's definitely a thing. It's often called solution-focused therapy, and maybe 5 or 6 sessions, and you can work to develop some skills to help kids identify why some of these things could be concerning and what to do about them. So.
Yeah. Okay.
Yeah.
Yeah, and one thing you mentioned that I kind of want to elaborate on just real quick is, it's as easy as meeting with your pediatrician, and I think that's really key. Is that I think a lot of folks don't realize or don't understand sometimes is that mental health is no different than physical health. So if I was having heartburn or, pain in my hand, I would go see my physician. And, but if I'm depressed or anxious, you can still see your physician. And so, mental health, physical health, they're all in one. And so we should be treating them together.
Yeah. I agree with that.
Next question is, how do you get your teen help when they don't want it or they refuse to believe there's a problem?
Yeah. This is a tough situation, of course. I don't have an exact answer, but I can give you some tips. Of course, again, immediate concern, go to the emergency room, or inpatient. And if you need to have EPC or, police or emergency personnel to help, they are available. But that's in a crisis situation. If it's not necessarily in a crisis and you're struggling to communicate, again, use your resources. Talk to your school resources, like the school counselors or social workers, teachers maybe they're close to, that they might be able to talk to them. Again, those screening tools, the suicide behavior questionnaire, can maybe give them some insight that they're not willing to look at. As we said, the doctors, the pediatricians, and the primary care, extended family that you and they can trust are another option, and maybe even friends if they're, helpful to good, people you're close to and can trust. But ultimately, going back to that building connection piece is so important, and there may just be some barriers to trust and safety that are keeping them from being willing to look at that problem. So, and family therapy can be helpful in those situations.
Yeah, so there's a lot of resources, a lot of help, a lot of support. So if folks have questions, don't hesitate to reach out and just ask. Oftentimes we get a lot of calls and folks just say, what was that you mentioned? What are the steps that we should be taking? We're here to help.
Absolutely.
Yeah. So how do I best support my non-binary gay 13-year-old child?
It's a hot topic, and one I think as parents it's hard to understand fully because we didn't have all of that when we were growing up as much. Certainly that non-judgmental approach when communicating is key. Educating yourself. So the Trevor Project, in addition to the crisis response resources that I mentioned earlier, they have a significant amount of resources that can help learn how to support and understand, the problems in the LGBTQ plus community. For local resources, so that's national, the Trevor Project. The local resources, outnebraska.org is a wealth of knowledge. You can be connected to local support groups, local hotlines, basic needs, legal resources, medical needs, those kinds of things. And there are actually other psychological and or providers and clinics that specialize in LGBTQ plus issues. So those would be a good resource as well. But I think that, making an effort to better understand and them and how they identify is just a show of how you care, and it can help them, see you as supportive.
Absolutely.
Yeah.
Okay, thank you. Next question is, my daughter has expressed fear about being shot at school. What can I do to help her overcome this fear?
So that's another problem that's pretty significant in this day and age. Following the protocols that you're taught in school is essential. There's been a lot of research to show that these are what we should be doing. This is the best way to keep safe. I imagine they're not doing them if they're. But just having that open conversation about it and talking about, do you know what the plan would be, being prepared for any of that kind of thing. Those are the best options as far as that goes.
Yeah, and then I also, normalizing too as a parent, talking about, this is what we do at work to safeguard things at work, yeah. And letting them know that that they are safe, and because there's a lot of things obviously happening in the world today, and minimizing the media and media exposure, but letting them ask questions and answering their questions. So going back to what you were saying about just what questions you have about that and being open. So yeah, really good information. We don't have many mental health resources in rural communities. What is the best way to access resources in rural areas?
Yeah, this is a valid concern. I have family in rural areas, so I get it. One of the best things, I think, from the COVID pandemic, at least for my world in the healthcare, is the mainstreaming and the normalizing of telehealth care. I wasn't doing it before COVID, and I learned quickly how to do that. In Nebraska, licensing regulations state that a practitioner can see anyone in the state of Nebraska as long as both parties are in the state of Nebraska. So if you're in Omaha and you want to see somebody through telehealth that's in Scottsbluff, it works. I mean, so we have those resources just for regular therapy. I mean, lots of areas in healthcare, but we've also developed programming with, I think, 15 different rural emergency departments where they can telehealth into the Bryan inpatient unit and have an assessment done over telehealth for inpatient services. So,
yeah. So it goes from the Bryan. So if you go into the Bryan emergency room today, you could be seen in person. But if you're in one of those 15 rural hospitals, you could go into that emergency room, and then they will telehealth directly to the Bryan West emergency room, and you'll get that same mental health assessment to determine if you need to be hospitalized, and saves you a trip to Lincoln.
That's right. And then there are also 6 behavioral regions that we have links to on the reference page that can be a wealth of knowledge. So.
Yeah, there's so Nebraska is broken up into 6 behavioral health regions, and so those 6 regions receive state and federal funding to kind of help with some of the different services in those areas. And so that's one way. If you're in rural Nebraska, you could reach out to your regional office, and if you're not sure of what's available out there, and just connect and say, hey, what's available that I could connect to for mental health resources. And so there's a link in that resource page that we talked about that gives you the contact information for your regional authority in your area. And the other thing I wanted to mention is then the SAMHSA treatment locator is also on one of those links. And you just type in your zip code, and it gives you, the provider closest to you.
Yeah. Great resource.
Yeah. So what is the best way to approach difficult conversations about mental health?
And again, I would just point back to that compassionate but direct and non-judgmental approach. I mean, everybody's situation is different, but I think if you just look at it from being direct, being non-judgmental and compassionate, that's the best way. I mean, going back to those advices on what kinds of things to say, and some of those other resources will have other things for you to look at too in that respect.
Yeah. And there's, again, I've said this several times, but there's hope, there's help. There is healing. Mental illness is treatable, and when we talk about depression and anxiety, they're the most treatable mental illnesses. So, it's letting folks know that you're going through struggles now. Let's go talk to somebody. Let's get you connected to resources because things will get better. And just letting them know that there is might be tough right now, but it's going to get better. And so those are tough conversations to have.
Yeah, absolutely.
So what effects do you think the pandemic has had on our children and their mental health?
Yeah, I think it's been significant. I don't know that I've seen any specific data that's come out with this yet, but I think part of why we're doing this tonight may be part of that answer. We're seeing these increases in these issues with adolescents, and again, we don't know 100% how much COVID and the pandemic played into that, but in my experience, the 15 years I've been doing this, I've seen a lot more anxiety, a lot more depression since everything erupted 3 years ago. So I am very curious to see what those data points are going to look like in the next several years as we start running them. But I would say, yeah, I mean, just the isolation and the fear for our health that we were inundated with for forever, justifiably, but yeah, I think it's created anxiety and depression issues.
Yeah, absolutely. So what should I do if I think a teen is using marijuana? How are substance abuse and mental health related?
So again, the Independent Center has that, the evaluation, the screening tool on the website. So you could start with that. If you, again, the direct conversation with them, there are treatment options that they can hook you up with through the Independent Center if that is necessary. Substance abuse is most often a mask for mental health symptoms. It's a self-medication tool. But the thing is especially marijuana, the potency of it has increased exponentially over this last several years and decades than what others have known it to be. And so it has a profound effect, and there's definitely research that points to a link between depression and marijuana use and alcohol use. So.
Okay. What are mental health first aid trainings and why are they important? Well, one of the things that mental health first aid is a training that individuals can take, and I'll let you talk a little bit about your experience with mental health first aid, but I'll just mention the training. And so I gave folks some information here a little bit ago about the region contacts. So here within the Region 5 area, which includes Lincoln and the 15 counties around Lincoln, if you go to the contact Region 5 systems here in Lincoln and go to their website or just contact them, they provide mental health first aid trainings once a month. And those are free and available to anybody who wants to attend. And so that's basically for the lay person, somebody who's not a mental health clinician, but somebody who wants to get trained on, what are the signs and symptoms, what are the things I should be looking for, and then what are some of the resources I can connect people to. And so it's a great training.
Yeah, I would reiterate that. And I do think they're doing not necessarily that, but they're doing some of that training with kids in the schools. They have hope squads and different things where the students can help support their peers, and it's very similar in that respect.
Absolutely.
So that's a really promising thing as well.
Yeah. Mm-hmm. Yeah. And the other piece is then also the QPR trainings, question, persuade, and refer, which is focused on suicide prevention, and you can get that training through the region as well. And again, through the Hope Squads at the schools, a lot of the schools have these Hope Squads, and the students are getting trained on that as well. So just a lot of great resources here in our community. Well, thank you for all the great information tonight. We've covered a lot of information for folks to take with them and to link to. So we're going to go ahead and wrap up for today. But before we move, before I do a closing, I want to just see if you have any final comments that you want to leave with folks.
Well, yeah, I just wanted to say thank you for this opportunity. My goal today was definitely to increase this conversation and have more conversations about these issues in our community, brainstorming ways to interact and help out with these problems. It's definitely true we need more resources for the youth across the board. So, if parents and caregivers can get involved and help us with that, that's great. I would love to see continued and increased collaboration among medical, mental health, educational, legal, community service, resource entities, all of those things to really kind of develop a coalition to tackle this problem. Because the youth is our future. And if we can provide support and help them build resiliency, they're going to be more able to handle the stressors that come in life. So.
Well, thank you again. It's been a great spending the evening going through these questions and sharing information with our community. And we hope this discussion has been very informative and helpful to you in addressing this critical issue of adolescence and mental health. Remember, if you do have concerns about your teen's mental well-being, you don't hesitate to seek professional help. Together, we can work towards creating a more supportive and caring environment for our teens to grow and thrive in. Have a great evening. Thank you.